Ladies and gentlemen, may I have your attention, please?
Covering both sides of the big issues with the analysis you trust on Newsradio 1040 WHO.
Is a lot of healthcare workers are quitting. They are traumatized by their last year in the healthcare industry. And Dr. Fahmi Farah is back on my Newsmaker line. Dr. Farah has been on the front lines of this. Dr. Farah, welcome back to Iowa Radio. Good morning.
Good morning. Thank you for having me.
Dr. Farah, what are you seeing on the front lines? Are healthcare workers just throwing up their hands and saying, I can't do this anymore?
The last 1 year has been just so overwhelmingly difficult for so many healthcare workers, physicians, nurses, everyone alike. There is no doubt that there's some amount of burnout among healthcare workers because of the simple fact that they've been having to work a lot harder. The work hours have been longer. In many situations, they've been having to work 2 to 3 times the workload. So all those things, all those factors are contributing to the burnout.
Is there anything that could be done, Dr. Farah? That, for me, that's the issue. Obviously, particularly in rural areas of Iowa, you need healthcare workers. And so is there anything we can do to help healthcare workers?
Yes, I think the key thing healthcare workers really need right now is support from all levels. The workplace where they work, like hospitals, I really think the hospitals need to step up and support their healthcare workers more by providing more help, basically, and reducing their workload so that they're not as overwhelmed. One of the other things that a lot of healthcare workers are dealing with is mental health because, at the end of the day, they're all humans. And, the last 1 year has been very different and difficult in the sense that healthcare workers have been seeing more sick patients. The COVID-19 patients have been super sick. Many of them were not successful, with their treatment because the death toll was so high. And having to deal with that loss, that trauma, it takes a toll, So being able to openly discuss and receive help for mental health, for depression, I think that would be huge support that healthcare workers need right now. And the other thing is family support, so all those things would be very helpful.
Dr. Farah, I know it was a tough year for healthcare workers, and one of the things I saw was that because family members couldn't come into either long-term care homes or hospitals, they not only had to treat the patient, they really had to be the family to the patient too, didn't they?
Yes, and that's what I meant when I said, it's very different. You're absolutely right. In most cases, family members were not allowed. Even in really sick patients who are not going to make it, the family members in many instances have to see them through video conferencing, not face-to-face. So you're right. The healthcare workers' burden was not just providing care at a health level, but also as family members, providing that support. It was huge.
Dr. Farah, is there an instance where you've thought, it would be best for this person not to be in healthcare anymore, where it was just too overwhelming for them?
I have not experienced anything like that. I mean, for the most part, the people who choose to go into healthcare profession, they truly are compassionate people. They truly do enjoy and love providing care to people. So for the most part, I think I have not seen anybody quit. In my experience, I have not seen that. I mean, sure, there's unhappiness because, as you know, the satisfaction rate has dropped from 70% to 49%. But I think once they receive the support, once the overwhelmingness of the workload decreases, my hope is that things will go back to normal because, like I said, most people who are in the healthcare profession, it's because they truly do care about being in that profession.
Dr. Fahmi Farah, she's been on the front line of this pandemic. Dr. Farah, always appreciate your perspective. Thanks very much.